Welcome back to the Healthy Mouth Movement. Today I have Dr. Steven Schluentz. He's from Philadelphia, Pennsylvania. He's been a dentist since 2012. He helps doctors and dentists learn more about TMJ and how we can help our patients better their lives. So welcome and thank you for being here.
Awesome. Thank you so much for inviting me, and I'm excited to be here and share whatever little bit of information I can give to your listeners.
So since you specialize in TMJ, that's what I'd like to talk about today. What is it that you would like patients to know about TMJ and what they should look for and symptoms that they might be having?
Yeah, that's a great question, and pretty early out of dental school. Dental school was great at teaching me certain things, but I was seeing a lot of patients, even in my own office, that I would think wouldn't have the symptoms they had. And they would go see chiropractors, they would see naturopaths, they'd see all these different alternative medicine sources, and they still were dealing with certain issues. And I started looking for some answers. I would see a lot of tooth wear. I'd see a lot of issues, recurring cavities and breathing issues, and sometimes they were diagnosed with sleep apnea. And I started to look, is there a link between all of this stuff? And that kind of led me on a path. And my aha moment when I started to learn how to treat TMJ the way that I do it, which is all about stabilizing systems and then restoring back to health, was I had one patient that she had chronic shoulder pain for 10 years, didn't tell me about it. We actually went through this process together. And within a week, this chronic shoulder pain she had for 10 years completely gone.
Wow.
And that's when I started to really get interested, not just in my own practice, how to help patients with TMJ, TMD issues, but how to help other dentists do this in their practice as well. And, we just see so many things in our office that if we aren't aware of it, we just kind of ignore it. But patients out there are suffering from TMJ, TMD, like symptoms, headaches, neck pain, shoulder pain, facial pain, tightness. And, I'm not saying that TMJ and TMD, temporomandibular joint disorder, is the only reason they have those things, but sometimes it can be an underlying reason. We typically don't think about it, but it is important.
Yes, it absolutely is. And I think that's the message that we definitely want to get out there is a lot of things that are happening with our young adults, with our older adults, they start in the mouth. And we're not making that connection.
That's it. And I'd love to say that the majority of my patients that I treat are young, but they're typically not. What ends up happening is things that we thought were not significant when we're 10, 15, 20, we kind of just ignore it, and it goes away. It doesn't completely go away though. And those signs that we had turn into symptoms, and then the symptoms turn into some really severe debilitating problems. And then by the time that I usually get involved as a dentist, the cost of treatment has went up dramatically to get them back to a state of health. So I see a lot of patients in their 40s and 50s for treatment that if we were aware of some of these issues early on, we could have avoided a lot of problems. And now I think dentists, and that's one of my missions, is helping dentists become better educated and aware of what they're seeing for their patients, so that ultimately they can give their patients some better choices in terms of how they want to potentially avoid a lot of dental problems that we see. I mean, teeth breaking, teeth cracking, now you need root canals, now you need crowns. Typically, tooth wear and teeth breaking and cracking are usually a sign of breakdown in the whole system. It's not just that the tooth decided to break one day. It was that there was a pressure source or something that was causing a malalignment, and all of a sudden that tooth just breaks. And now we need extensive dental work on just one tooth. And you're still not actually creating a solution. You're just solving a problem at that one point in time. And then all of a sudden, 6 months, a year goes by, and now we have another problem. And then another tooth breaks, and then another tooth breaks. And we're always reacting to disease as dentists. There is another way. And that ultimately benefits patients because now they know they're working towards something rather than just treating symptoms of an underlying cause that's undiagnosed.
Right. And a lot of times the teeth aren't just about straight teeth. It's about aligning for function because of how they're hitting. And when your teeth are not aligned, it can also cause some of the gum disease and recession and things like that you're having, correct?
Absolutely. I always tell patients it's pretty simple. you have kind of three things that are either working with each other or not. That's your muscles, your joints, and your teeth. And if we can bring your muscles, joints, and teeth all in alignment, you'll probably have pretty good success going and seeing a dentist over your lifetime. If those three things aren't in alignment, sometimes you luck out and you still have very minimal issues. But if you're prone to having issues and those three things are not in alignment, you're going to see recession, gum and bone loss, abfractions, which is basically notching of the teeth. You'll be more prone to getting decay. You'll have more symptoms in terms of headaches and neck pain. And the issue is sometimes we don't typically think as patients. I know when I started learning about this, it wasn't the first assumption that a shoulder pain could be related to how my jaw joint is centered in the socket. But you learn that these things are all connected. And the more we understand this connection between all of these pieces, the healthier we're going to be. And so it first is just the awareness of asking the right questions for your dentist and your hygienist. Hey, I'm experiencing these symptoms. Could this be related to the way my bite works or the way that my mouth is working? I can't tell you how many countless patients have headaches that until I see signs in the mouth and I ask them questions about potential headaches they have, that they finally say, I never would have thought that my headaches were related to my mouth. And I've been going to chiropractors, I've been going to, physicians, and they're giving me medication for this, or I'm going to neurologists and they're giving me these really heavy dose medications that aren't solving the problem. And so I'm continually dealing with these symptoms on an ongoing basis. I'm not saying again that there's some other things that can cause headaches, but oftentimes dentists are way down on the totem pole in terms of, what should I be asking my dentist? And even if you do ask the dentist, sometimes the dentists just aren't trained and educated in temporomandibular joint disorder. I get a lot of dentists that send me patients because they don't do that and they don't want to do that, and that's okay. But now I am actually able to help some of these patients.
And so they have to find a provider. So what do you think about people that are on CPAP machines? Do you think that a lot of the CPAP machines stemmed from that situation, not being able to breathe?
I think that there's a good majority of people that have sleep apnea and obstructive sleep apnea that could benefit from looking at how pivotal the airway is related to the mouth and vice versa. And again, I would love patients to not have to wear a CPAP machine. And there are some modalities of treatment out there that could replace CPAPs. And I think we as providers are getting more and more aware of how prevalent sleep apnea is, the different types of sleep apnea, and how to best treat that. But yeah, we see a lot of patients that are wearing CPAPs because of an underlying dental issue. Now, we also see patients that don't wear their CPAPs, so they're really not benefiting them. And, we want to be able to provide solutions to those types of patients as well. So, we see that a lot, that these patients now are not getting diagnosed though until they're in their 40s, 50s, 60s, 70s. And a lot of patients that I see that have sleep apnea are not the traditional patient that you would think has sleep apnea. We as dentists typically think 50s, 60-year-old male, obese, big neck. Those are the things that we learn as providers. Those are what we want to look for. But I see a lot of 30s and 40-year-old females that are completely healthy, they're not obese, and they have severe sleep apnea. And those are the ones that typically go under the radar. And then they start to have the headaches and the joint pain, and they can't sleep at night. And they're listening to their husband snore because he also has sleep apnea. So there's just this thing that we see, and then we want to say, well, let's continue to monitor it, or we put them on a CPAP. There's some things that we should be identifying a little bit earlier. And you can actually see a lot of those patients very early on, 1-year-old, 2-year-old, 3-year-old, they're just not breathing, they're not developing properly. And the earlier you intercept the problem, the better the long-term solution will be for, the patient.
Yeah, my mom has sleep apnea and she will just stop breathing. And I know that it freaks my dad out a little bit. And I told her a few years back she should get braces, but she's in her 70s. And she's like, I'm not going to go see an orthodontist. I'm not wearing braces in my 70s. But she has the, tucked back chin, the vaulted palate. And I'm like, Mom, I really think you could benefit. And she's just like, nope, I'm not doing that. but she struggles with breathing.
And it's very typical because what will happen is if things are tucked back, like you said, basically there's not enough room in your mouth for your tongue. And so your tongue is restricted and it gets pushed back and it actually closes the airway. So you are having a difficult time physically breathing. And so you think about it, if you lay back, then the tongue falls back even farther and you stop and you gasp for air. Then that also contributes to clenching, grinding, teeth breaking. One of the things we see as dentists and what your listeners can tune into is look at your teeth. Usually the teeth are a signal for something. If they're cracking, they're breaking, you're wearing your teeth down, they're chipping. By and large, those are usually symptoms of sleep apnea. And so when we see patients in their 30s and they have wear on their teeth that make them look like an 80 or 90-year-old, we know something's going on in the system. That's not normal. So it's a simple thing you can ask your dentist. How much tooth wear do you have? Because as patients, we don't see it. It's like watching paint dry. So we're not going to see every time we come in that our teeth are getting smaller and smaller and smaller. But if you take 5-year snapshots, you'll see the progression of tooth wear. And that's almost always a symptom of sleep apnea. So again, there's other things that can cause tooth wear, but that's one of the very most common things that we can see as dentists that signal there might be something going on is severe tooth wear, teeth that are breaking, teeth that are cracking, especially in the front. Maybe you've done crowns or fillings in the past. They don't last, they break. Those are usually signs and symptoms of something else that could be happening as well.
So what would you have people ask, like questions-wise? What should they ask themselves and then ask their dentist?
The first thing they should ask themselves, again, seeing TMJ and knowing that there's solutions out there. If you've been suffering with headaches and neck pain and jaw pain, and you haven't been able to get solutions through traditional measures, maybe you have seen neurologists, maybe you've seen chiropractors. There's reasons you go see chiropractors and neurologists, but if you're not getting relief, start to ask yourself, could it be a dental problem? If it is a dental problem, simply ask your dentist if they're seeing signs of wear, symptoms. Are my teeth wearing faster than they should be? I'm having headaches, I'm having neck pain. Could this be related to my bite? And then also, I think the biggest thing for patients to understand is every dentist is a little different and we all have our own unique skill set. Because simply, sometimes dentists may recommend a night guard for you. A night guard may not help your problem. And that's the biggest thing that I probably combat in my office is I tried an over-the-counter night guard, I didn't wear it, it didn't fit, it didn't feel good and I couldn't sleep in it. Or my dentist had tried this in the past and it doesn't work. Night guards are very similar to me if you're thinking of a painter and you gave me a paintbrush and a blank canvas and told me to paint something. And then you told Picasso to do the same thing. The painting you're going to get from Picasso is totally different than the painting you're going to get from me. So every dentist is trained a little bit different with regards to TMJ and TMD. I strongly believe that every dentist should be able to diagnose it at some level and then also be able to get you to the right person. I wouldn't try to do, a heart replacement for you. I'd send you to a cardiologist. And it's the same thing in dentistry. Not all night guards are created. Not all bite appliances are created equal. And so you have to be able to ask the questions and then also be receptive to doing some of your own research and getting answers. And, I have honestly, patients have called me from Los Angeles and I'm in Philadelphia just to see, is this something that's related to my bite? And I'm always happy to help them. I can do a virtual consult and just say, okay, this is where you're at. This is where you could potentially go. And the cool thing about being a coach is I actually now know a lot of dentists that do this type of work. So I have my own little network and referral system that I can get, patients, if I can't treat them, to the right person in their area.
That's awesome. That's good to know. So then the last question that I want to ask you is about Smile Direct Club and the DIY orthodontist, because we're seeing a lot of things happening because patients are trying to do it themselves and it's actually ended up being more costly because they are doing it themselves. How do you feel about that?
Well, I don't want to be sued by Smile Direct Club. So I will say this. There are cases that probably could be handled with DIY. And the issue is you don't know if you're a case that actually could be handled because there's not a lot of direct involvement with a dentist in any situation like that. And so be very careful when you decide to move forward with that. I always tell patients, if you broke your arm or your leg and you wanted to go to a physician that said, we can straighten that for you and fix it, you just take a photo and a mold of your broken arm and we'll send you a cast and you'll be good to go. You just put the cast on. You probably wouldn't do that. And in dentistry, it's the same way. So you just be very, ask yourself, would I do this? If this was any other medical treatment, would I do this? I can't make you do it or not do it, but just be aware because we do see patients that do have issues as a result of that. But we also have patients that don't have issues. And so if you look at Smile Direct's website, they're going to say that, which is, we can't guarantee results. Use it at your own risk. And that's the best piece of advice I could give you is just think about it before you do it. There are cases that work out really well, but then there's other cases that absolutely should not be done directly without any type of dentist or orthodontist intervention. And those are the patients you'll see come back. And it's really, to me, sad because now them trying to be proactive and get straight teeth and get what they want have created a multitude of problems that will not be able to be fixed by doing new ortho. They're going to need a lot more work. You could have bone loss, you could have gum loss, you could have irreparable damage. You can't simply just put the teeth back where they were. That's not possible sometimes. So you just need to be aware of some of the risks before you decide to do it.
Yeah, once it affects the TMJ, that's what I'm seeing is, some things happening with TMJ that seem to be more extensive once they've tried to do it themselves. That's what I'm seeing with patients.
TMJ can definitely get affected by the alignment of the teeth because, again, what we talked about, the alignment of your teeth, your muscles, and your joints all factor into TMJ. So if you get that alignment off and you didn't know that you had an alignment problem to begin with, you will have a lot of problems that are not going to be solved by putting the teeth back where they were. It's Pandora's box. Once you open that thing up, it's hard to put everything back in there.
Yes, it is. So I want to thank you for being with us today. Great information to share with our listeners, and hopefully we can do this again on another subject because I think you have a lot of information to offer. So if our listeners would like to get a hold of you or get more information of you, where can they find you?
Yep. So the office that I'm working out of in Philadelphia is Sleek Smile Studio. I think you can go to sleeksmilestudio.com. I also have a TMJ channel that I'm starting on YouTube, so that's still in development. But you can go to sleeksmilestudio.com is the best way to get in touch with me, or you can send me an email directly to steve@mountainskycoaching.com. If you are a patient that's wondering about some of these things that we talked about and you need additional help, feel free to reach out to me. I'd love to help any way that I possibly can.
Awesome. Thank you so much for being here and sharing all that information.
Thank you.
For more information and to read the blog post, go to www.dentalhygiene411.com. Like, comment, subscribe, and share, and hit the bell for notifications of every Monday's new episode.